All right, well, thank you so much, everybody, for joining us on another edition here of ExtremeHealthRadio.com. It's an honor for us to be here, and it's a lot of fun to bring these shows to you, and really excited about today's guest. We're going to be talking about heart health and heart disease and heart attacks. So as someone who was diagnosed many, many years ago with hypertrophic cardiomyopathy, this will be applicable to me too. So I want to thank you for joining us today, and just to let you know, we do shows 3 days a week. Actually, we do shows 4 days a week now, Monday, Wednesday, and Friday, and Sunday. We just added the Sunday show on. And if you would like to join our community on Facebook, we would greatly appreciate that, and would be glad to have you on board and joining that. You can check it out at extremehealthradio.com/Facebook, and we talk every day on there. And thank you to Mike Adams of naturalnewsradio.com for having us on his network. That's a lot of fun to be on there. And just for reference, today is Thursday, January 10th, 2013. It's already January 10th. I cannot believe that. That's amazing. Amazing. This is episode number 57, so you could find it at extremehealthradio.com/57, and you'll find the show notes and transcription and any websites or reference materials that the doctor mentions on today's show. You'll find it on that page. And if you have any questions, email me. I'd love to hear from you, Justin at extremehealthradio.com. And you can ask a question to our guest or just to me. And you can also call our voicemail line, which is 949-391-7363. And you can leave a message there, and I'll play it to our guest, or you can leave a message for me. Either way is good. And I want to let you know also that this show is brought to you by Amazon.com. That's a great way for people to support us. Anytime you make a purchase from Amazon, just go to extremehealthradio.com/Amazon, and that will redirect you over there, and we'll get a little commission for your order that will support our show. So thank you to those who have bought recently. We appreciate that so much. I want to talk a little bit about our upcoming show schedule. A lot of great guests coming up, a lot of cutting-edge people. On Friday, we have Dr. Raymond Francis from Beyond Health. That should be a really, really good show. He does speaking worldwide and has written books and has products and is really cutting-edge kind of guy. And then we're going to take a little break this year, but on Monday, February 11th, we're going to have Annie Jubb from AnnieJubb.com, and she does work with Life Food. So that should be interesting to talk about the liver and how to cleanse your body. And then on Wednesday, February 13th, we have Janice Barcelo from birthofenewearth.com, and we'll be talking about childbirth and hospitals and all of that interesting information. So that should be a really interesting show. And today, talk about interesting, we have Dr. Caldwell Esselstyn. His website is heartattackproof.com. He's a fascinating guy, and he's received his BA from Yale University. In 1956, he won the gold medal on the rowing team for the Olympics. Amazing. And he was trained as a surgeon at the Cleveland Clinic and at St. George Hospital in London. And he was an Army surgeon in 1968, and he and his wife has been following a plant-based diet for more than 26 years. And he also directs the cardiovascular prevention reversal program at the Clinic Wellness Institute. So thank you so much for joining us, Doctor. Appreciate that.
Well, I'm delighted to be with you, Justin.
Wow, this is our first interview on heart health, and I'm excited because, as you may have heard in the intro, I was diagnosed myself when I was a teenager with hypertrophic cardiomyopathy. As far as that goes, is that a very, very dangerous condition? Because a lot of athletes seem to have that these days, it seems.
Well, I think it would be inappropriate for me to try to discuss with your audience hypertrophic cardiomyopathy. That is a sort of a special situation that people are born with. And with each decade that goes by, people are able to get more and more sophisticated about how to deal with medication, drugs, and when necessary, procedures. But I think the message for your audience today that I would prefer to emphasize is the leading killer of women and men in Western civilization, which is coronary artery heart disease or heart attacks, because there's something that everybody can do at home for themselves to really make themselves heart attack proof. Because if the truth be known, here we have this leading killer, women and men in Western civilization, which truly is nothing more than an absolute toothless paper tiger that need never, ever exist. Mm-hmm. And if it does exist, it need never, ever progress. This is a benign, foodborne illness. And I think the way we got our insight into this illness was when we really look at the epidemiology of this disease. That is to say, if you were to look, or if you were to hang out your shingle as a cardiac surgeon in rural China, mm-hmm. The Papua Highlands in New Guinea, Central Africa, or the Tarahumara Indians in northern Mexico, forget it. You better plan on selling pencils. Mm. There is virtually no cardiovascular disease in these cultures because by heritage and tradition, all their nutrition is plant-based. They are not eating any of the building blocks of heart disease. And it was really quite striking when you look at the contrast. We, in the early 1950s, when reports came out about the autopsy results of our young soldiers, in Korea, fully 80% of these men at an average age of 20 already had gross evidence of coronary artery heart disease you could see without a microscope. Not enough for their clinical event yet, but there was, the disease was established.
Wow. And
there was a more recent study of several thousand of our GIs who have died in the Afghanistan and Iraqi wars. Mm-hmm. And it's no longer 80%, it's actually only about 8%. Well, what is responsible for that, obviously, is there's certainly been 50 years, since the past 50 years, there's a much greater emphasis and understanding on levels of cholesterol. People have changed their eating habits, and most importantly, they've changed smoking. And also, it's really not a comparable study because back in the 1950s, I remember that was a drafted military. People were just taken off the street. Mm-hmm. And nowadays the military is those usually who really have to be quite fit to qualify for this volunteer army. But perhaps more profound is the study from 1999, 45 years later. Mm-hmm. Now, looking at young people between the ages of 17 and 34 in this country who have died of accidents, homicides, and suicides. Mm-hmm. And now, again, the disease is ubiquitous. That is to say, it's not 80%, it's 100%. Well, what's going on?
Wow.
Well, I mean, here you are. We graduate from high school in this country. We get a diploma. And we also get the foundation for coronary artery heart disease. So it's no wonder if the disease is present in people in their 20s and 30s, that is, they continue to eat the same way through their 30s, 40s, and 50s, and so on. Now we finally begin to see these clinical events, heart attacks, stroke, and sudden death. And it's something which is absolutely the exciting thing about it. It is something that we totally can alter and change. There's another very interesting bit of epidemiologic data that occurred back in World War II, but we really, as a medical profession, we sort of blew it. Mm-hmm. And that was when the Axis powers of Germany invaded the Low Countries of Holland and Belgium, and they occupied Denmark and Norway. It was characteristic of the Germans that they took away from these countries, they took away their livestock for their troops, that is to say their cattle, their sheep, their goats, their pigs, their chickens, and turkeys were gone. So suddenly now, these Western European nations in 1939 to 1945 were really without any choice, they were now plant-based. And it was quite interesting that the doctors Strom and Janssen, reporting in 1951 in England's leading medical journal, The Lancet, they documented the fact that during this wartime, when Norway specifically was depending more and more on plant-based nutrition, mm-hmm. there was an absolute plummeting of deaths from heart attack and stroke. And if you look at the study as it's presented, is quite striking that after the death of Hitler, with the cessation of hostilities in 1945, mm-hmm. when these deaths from heart attack and stroke in Norway were so low, literally within 3 years, back comes the meat, and back comes the dairy, back come the strokes, back come the heart attacks. Within 3 years, they were back to what they were in the pre-war level. So it was really quite profound. But as I say, as a medical profession, we didn't really take that to heart as a lesson.
So what do you think is more, damages the heart more or the arteries more, the cholesterol or the sugar levels that are in people's bodies? Is one worse than the other?
I think I don't think there's any question. It's a combination, because I think what we want people to focus on, at least when I conduct our intensive counseling seminar, which I do once a month at the Cleveland Clinic Wellness Institute, what we try to emphasize is that we want to show people great respect and give them about 5.5 hours in a single day seminar, so that they totally get their arms around what it is that they have been doing to destroy their blood vessels. Now, I think it's important here to maybe we have to reach out for a few words or terminology that your audience may not be familiar with. And that is that all experts in this disease would agree that the absolute guardian and life jacket of all of our arteries is this single layer of cells on the very inside, which is in contact with the flowing blood. And that layer of cells has a name. It's the endothelium, is the entire carpet. An individual cell would be called the endothelial cell. And it's interesting that up until about 1980, we used to think of these as simply cute little sort of bricks that were lining our pipes. But a great deal of information came forth here in the last 25, 30 years that these cells are not just little inert cells that are doing a job lining the artery. They are metabolically very active, and they produce an absolutely magic molecule that is so essential for the health of our vascular system. And that molecule is a molecule of gas called nitric oxide. I mean, just as you and I are speaking here, we're both making it, as are all the members of your audience. And it has a very short half-life of about several seconds. And what are the functions of this nitric oxide? Well, it keeps all of the cellular elements in our bloodstream flowing smoothly. It keeps them from ever getting sticky. Or sludgy. For instance, the endothelial cells itself, the white blood cells, the platelets, the bad LDL cholesterol, all of those are kept from becoming sticky by nitric oxide. Number two, nitric oxide happens to be the strongest, what we call vasodilator in the body. That is to say, when you climb stairs, the arteries to your heart widen, they dilate. The arteries to your legs widen, they dilate. That's due to nitric oxide. Number three, nitric oxide also will protect the wall of the blood vessel from becoming inflamed. It protects it from becoming stiff and hard, inflexible.
Interesting.
In other words, it protects us from developing hypertension or high blood pressure. Number four, nitric oxide in its normal, plentiful amount will protect you from ever developing blockages in plaque.
How does that work? As far as the nitric oxide, how does that prevent the plaque and all that?
Well, what happens is that the magic of this, when you think about it, I just mentioned a few minutes ago that by the age of 17, we suddenly now, if people die from accidents, homicides, and suicides, we see they already have this early streaking and early evidence of the buildup of heart disease in their arteries to their heart, the coronary arteries. And you might say, well, how does that happen? Because we don't see it in the Asians. I mean, I said it was 80% of the Koreans. It was only 1 to 3% it was only 1 to 3% in the Koreans, where it was 80% in our GIs. So what is it we're doing that's injuring the ability of the endothelial cell to make this wonderful nitric oxide? Well, we now know that there are certain foods that every time they pass our lips, we injure, we impair, and we compromise the capacity of the endothelial cell to make nitric oxide. What are those foods? The foods are oil. Yes, even olive oil, corn oil, soybean oil, safflower oil, sunflower oil, canola oil, palm oil, oil in a cracker, oil in bread, oil in a salad dressing, oil used to spritz the pan so stuff doesn't stick.
Are there any oils that are okay, or it's all oils?
No, well, I think it's fine if you want to take your omega-3 through green leafy vegetables, flaxseed meal, and chia seeds.
I see.
But I just as soon not have people take any fish oil. Matter of fact, there are recent, really meta-analysis studies of fish oil showing that there is zero benefit when it comes to heart disease.
Okay, doctor, we have to take a short break. I want to keep talking with you about these endothelial cells, and I think there's something called the brachial artery tourniquet test that I want to talk with you about, and how we can check these things out and all that. But we got to take a short break, and we'll be right back. We're with Dr. Caldwell Esselstyn. His website is heartattackproof.com. I would highly recommend going to his website. He's got a DVD there, and he's got his book there and everything. So a lot of great stuff on his website, heartattackproof.com. And we're going to get more and deeper into these issues when we get back after this break. Hey there, I hope you're enjoying the show so far. I wanted to tell you about the best alternative cancer treatment book on the market today. It's called Cancer Step Outside the Box. And you can check that out at extremehealthradio.com/cancer. And it's written by Ty Bollinger, and we've had him on our show. He was our very first episode. He's written a prolific book on cancer, talking about all of the natural cancer treatments that are out there that are on the cutting edge. Some of them have a 93% success rate. He gives you inside the book, which is like 400 pages, he walks you through all of the natural cancer treatments that are the most effective. He's got all kinds of cutting edge research on why chemotherapy just does not work, how to heal the body, how to cleanse the body, many different ways of cleansing. And he's got entire protocols of all the most popular and powerful treatments to beat cancer. Some of them even in the stage 3 area. I highly recommend this book. If you know someone who has cancer, or if you've been diagnosed, please get this book. It's really incredible information. You can check that out at extremehealthradio.com/cancer. And if you're interested in products like this, we've got tons of them in our store. So visit our store on our website, and you can find out a lot of other products that are just like this. So thank you for listening. Let's get back to this interview. All right, we are with Dr. Caldwell Esselstyn, and again, his website is heartattackproof.com.
It's Esselstyn.
Oh, Esselstyn. I'm sorry. Sorry about that. Caldwell Esselstyn, and his website is heartattackproof.com. And before the break, we were kind of laying the groundwork, you were, about the endothelial cells and why they're so important and how they relate to the nitric oxide and all of that. So I'd like to pick up where we were, because that was pretty interesting.
Yeah, I just was sharing with you what are the foods that would injure the endothelial lining and compromise the capacity to make nitric oxide. In other words, you've never heard of anybody at age 5, 6, 7, 8, 9, and 10 having a heart attack, right, obviously, but it takes a number of decades to continue to insult and injure the endothelial cell with the typical Western diet. Okay. So in addition to oils, what are there? There's dairy. It's milk, cream, butter, cheese, ice cream, and yogurt will injure the lining, injure the endothelial cell, compromise its ability to make nitric oxide, as will anything with a mother or a face. Meat, fish, fowls, that's chicken and turkey, injures the endothelial cell.
Does that mean like raw grass-fed milk and things? Is that different than regular milk, or do they all damage the endothelial cell?
All do, yeah.
Okay.
Yeah, I mean, for instance, people felt for the longest time it was if you had cattle that were grazing in the wild, and it couldn't be more in the wild than looking at the Maasai warrior in Africa, and Dr. George Mann in the American Journal of Epidemiology in the early 1970s actually went over to Africa and autopsied about 50 of these Maasai who had died and were more senior, and they were filled with vascular disease of the heart that we're talking about. So it doesn't even matter if the milk is raw or the culture or the race, right? Exactly. Because some people might think the Western people get affected differently than Africans, but even the race doesn't matter. Oh, no, there's no difference in ethnicity, right? Yeah. When we talked about the meat, and also for sugar is, especially it's fructose, which the work of Dr. David Lustig from the University of California in San Francisco shows that indeed fructose is very harmful to the endothelial cell. And that actually, where is fructose? Well, it's just practically all sugars.
Okay.
That is to say, it's maple syrup, molasses, honey. It's even orange juice and apple juice and agave. When you take an orange and you eat it, that's fine. You eat an apple, that's fine. But when you separate the sugar from being bound to the fiber in the fruit, now we've got fructose. And we just throw it in directly into our stomach, resulting in an insulin surge, injures the liver, and also injures the lining to the artery.
Wow.
But does that mean you're not ever supposed to have anything that has sweetness? No. If you can limit it to, say, 5% or less of the calories you're having, or have it infrequently, or just recognize the fact that this has the potential to injure you.
Okay.
Eat it rather sparingly. Coffee with caffeine can injure endothelial cells.
Coffee with caffeine. And are some fruits better than others, like berries versus bananas, or do they all kind of have the same effect?
Now we're first of all, we're talking about the foods that injure. That's getting the gasoline out of the fire.
Okay.
Now you brought up the question, should we do something else for patients perhaps who have heart disease? What can they do in addition to taking the gasoline out of the fire? Can they hasten? What can we do to put water on the fire? Well, I think an example of that would be if we were to tell people that the actual plaque or blockage in the artery, if you were able to get your head inside that, you would see that it's an absolute inflammatory cauldron. It's a cauldron of oxidative inflammation. So obviously what seems to be very helpful here would be to get some antioxidants. Now I have to emphasize at this point, when I say antioxidants, do not, I repeat, do not go down to the health food store, buy any jug of pills that says antioxidant. Not only will that not work, but it can be harmful.
Okay.
The body beautifully knows how to respond to the foods that are filled with natural antioxidants through our many hundreds of thousands of years of evolution. The body can safely ingest and take and absorb the micronutrients that are antioxidant and do it in a very safe manner. Now, the foods that are highest in what we call the ORAC value, O-R-A-C, oxygen radical absorptive capacity, these are mostly those wonderful green leafy vegetables, although there are nice antioxidant properties also in blueberries, raspberries, and strawberries. But it's the green leafy vegetables. For instance, if I have a patient who has heart disease, not enough, in my opinion, just to take away the foods that are injuring the artery, although that is going to be extremely important and beneficial. I want the double-sided treatment of pouring water on the fire. I want these antioxidants. So how do I get the antioxidants? I ask them to have green leafy vegetables. And I don't mean just a salad at supper time. If you have somebody with heart disease and they've got this plaque, which is an absolute oxidative cauldron, then I want antioxidants, wonderful antioxidants, pouring over this rascal all day long.
Okay.
I want a green leafy vegetable at 6 times a day. I want it alongside your cereal in the morning. I want a mid-morning snack. I want it with your lunch and sandwich, a mid-afternoon snack, with your dinner time, and obviously I love it when you have an evening snack of kale.
Yeah.
Now, how do you, if you want to have something the size of my fist in a green leafy vegetable 6 times a day, to make that, you just can't eat these things raw. I guess there are some Spartans who can. I can't.
Yeah.
But to make them taste delicious for me, I will cook them for 5.5 to 6 minutes, either steamed or in boiling water. And then I go to the internet and type in the olive tap. The olive tap can sell you these exquisite balsamic vinegars, and you put several drops of that across the green leafy vegetable. You swear you were eating a hot fudge sundae, and nobody will ever, that I know of, has ever gone to the emergency room with an overdose of green leafy vegetables.
What is that called? The olive tap, you said?
Yes.
Okay, and you can just Google that. That's a product you can put over it?
It's a company that will sell you these, got such a beautiful array of balsamic vinegars that they're very skillfully prepared. And I tell you, when you put them on these green leafy vegetables that have been cooked, you're really having a feast.
Now,
and at the same time, you're enhancing your health. There are an entire range of vegetables that we like, such as bok choy, Swiss chard, kale, collards, collard greens, beet greens, mustard green, turnip greens, Napa cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, and arugula and asparagus. Now, let's suppose that we recognize. Everybody probably in your audience now is wondering, I wonder what my level of nitric oxide is.
Right.
We've been saying how important it is. Well, there is a research test that's available to demonstrate this, and it's really how we learned a great deal about what are the foods that affect the capacity of the endothelial cells to make nitric oxide. This is the brachial artery tourniquet test, and the way it works is that an ultrasound probe is placed over the brachial artery at your elbow, and there on the screen you'll get a readout of the diameter of the brachial artery.
Okay.
Then for 5 minutes you will have a blood pressure cuff encircle your upper arm and have it inflated above systolic blood pressure, so that for 5 minutes you have absolutely zero blood flow to your forearm and hand. It's not bad. I've had it done myself. It's not habit forming, but it's not terribly uncomfortable. Then the cuff is released, and immediately you remeasure with the ultrasound probe the new diameter of the brachial artery at the elbow. And in the healthy individual, it'll be 30% greater. Well, the next great advance that came was with Dr. Robert Vogel, chairman of cardiology at the University of Maryland School of Medicine. Dr. Vogel took a group of healthy young subjects to a certain fast food restaurant. Now, half of those young subjects ate cornflakes, and their brachial artery tourniquet test stayed the same.
Okay.
The other half had hash browns and sausages. Within 120 minutes, they could not dilate the artery. That single meal had so compromised, had so injured their endothelial cell capacity to make nitric oxide, they couldn't dilate. But being young, as they followed them later on into the afternoon and early evening, they began to recover. But you and I know, in the good old U.S. of A., tomorrow morning it's going to be for breakfast scrambled eggs and bacon. How about lunchtime? It'll be mayonnaise with some cold cuts and white bread. And maybe at supper time we'll have a baked potato with sour cream, lamb chops, vegetables soaked in butter, ranch dressing on a salad, and ice cream for dessert. We just, and all those foods just hammer and injure our endothelial cells. So we start doing that at ages 3, 4, 5, and 6, right on up through high school and adulthood. And we are just constantly pounding away at injuring this absolutely gorgeous mechanism of the endothelial cells, which is there to help us. Now, you might say, well, gee, that's fine. Somebody might be 50 years of age, and they'll say, I'm going to stop this injury. I'm going to get my endothelial cells to come back. Well, problem here is, even if somebody is absolutely wonderfully healthy, the amount of wonderful nitric oxide that is produced by their endothelial cells at age 50 is half of what they were making when they were 25. Now, does that mean that the old carcass is going to let you down? No, absolutely not. Because what you can do, and this gets a little bit complicated, but I'm going to go slowly and we can follow it. There is another way that you can make nitric oxide through the gastrointestinal tract. If I can persuade you to ingest, or my patients with heart disease, if I can persuade you to ingest nitrates, I'm going to give you 6. Kale, Swiss chard, spinach, arugula, beet greens, and beets. When you eat and chew, remember no smoothies here or juicing or anything, when you eat and chew the nitrates, those nitrates will now mix in your mouth with the facultative anaerobic bacteria that normally reside in the crypts or the grooves of your tongue. Those bacteria are going to reduce the nitrates in your mouth to nitrites. When you swallow the nitrites, they are further reduced in your stomach by your gastric acid to nitric oxide, what we were looking for. And that nitric oxide can now enter your nitric oxide pool. On the other hand, the nitrites in your stomach that are not converted, further downstream will be reabsorbed into the circulation. And when the circulation reaches back to your salivary gland is going to concentrate these absorbed nitrites 10 to 20-fold. So that as you now chew additional food, your own salivary glands are going to contribute nitrites into your mouth, which when swallowed, again have the potential to be converted and reduced by gastric acid to more nitric oxide.
Wow, interesting. So I wanted to ask you too, really quickly, can a person just go to their doctor and get that brachial artery tourniquet test, or where could they go to get that done?
Absolutely not. Not yet. Not available. There are people are working toward it, but you don't have to, if anybody's understanding what we're talking about, and for instance, there's no need to ever have to get this test if you're just doing all the things you can do to maintain the integrity
Right.
and the functioning capacity of your endothelial cells. Recognize what are the foods that injure them, and recognize what are the foods that can enhance the ability to quell any plaque. And also, when you have a very, very, very healthy endothelial system, the cholesterol molecule is not going to injure it. It's when you continually beat down your endothelial cells with the foods that I mentioned, and the nitric oxide levels fall low. Mm-hmm. That's when things begin to get terribly sticky. So if you have then a sticky LDL cholesterol and a sticky inner lining to your artery, now the cholesterol is going to migrate through, because it's sticking there, gluing. It migrates through into the subendothelial space. Now it's in the wall of the artery, and as this continues to happen, now real havoc begins to develop.
Right.
Yeah.
And why is there cholesterol that are being deposited there to begin with? Is it caused by inflammation or sugar, or what's the cause?
The deposit comes about because of the injury.
Okay.
To the endothelial cell's ability to make nitric oxide. If you have plenty of naturally formed nitric oxide, the whole initiation of this cascade of events does not occur.
I see. Okay, so it's the initial injury from the foods that were...
Yeah, because what happens is as people continue to eat this terrible diet, sadly, you don't feel any pain or discomfort when your artery is building up these plaques. It's only when there's been enough decades of this that you have so much in the plaque and so much inflammation that it now ruptures. That is to say, the surface of the plaque, which was the fibrous tissue and the endothelial cell itself, becomes so compromised by all the inflammation that's going on inside the plaque, it ruptures. And now what happens is all this inflammatory cauldron begins to spill out into the flowing blood. And there it activates our platelets, which are our clotting factor. And that leads to a clot forming where the plaque is ruptured. And when the clot reaches all the way across the artery, now we have a totally blocked artery, and that's the causation of 90% of heart attacks.
Wow. Golly, man. If people knew this...
Yeah, people can, rather than end up spending your life taking a lot of drugs and pills and stents and bypasses, right. Personal behavior change is what is key. Now, obviously, we've now had about a 27-year experience dealing with this, and I can simply tell you that really what's been so exciting to me is that when patients do this, they suddenly, literally, especially those who have chest pain, will suddenly see their discomfort, their angina, improving literally within days in the first few weeks.
Wow. And
it really makes them so proud and excited to think that they themselves can be the locus of control. Wow. What is perhaps sad about this today, and I have nothing but the greatest admiration and respect for my cardiovascular colleagues, but they are the first to admit that they are not treating the causation of the illness. None of the drugs, none of the stents, none of the bypasses are treating what has caused the illness in the first place.
Right.
And it's really quite exciting to see this happen. Now, also, I think most of cardiovascular medicine feels that many patients won't make this transition. They will claim that the diet that we suggest is perhaps extreme or radical. Mm-hmm. And I would counter by saying I think that's totally incorrect, because if we really look at the facts, the nutrition which is most extreme and most radical is the one that insidiously is working away to destroy your arteries, so that by the time people succumb, practically 1 out of 2 Americans will have cardiovascular disease.
Right.
And yet the exciting thing that we found is that patients are not only are they excited to learn about this, they actually rejoice, because they now know that they themselves can become the locus of control to halt and reverse this disease.
Right.
Now, why is it that we succeed where perhaps others may fail? Well, I think one of the ways that you're going to get behavior modification is to show respect to the patient. And our counseling seminar is actually 5 hours on a single day with the patient, and we always insist that the spouse come for free. If there is no spouse, then it can be either a sibling or an offspring. But when we have this sort of significant behavioral change, you've got to be able to have the time to have the patient understand what it is that has been responsible for the causation of their illness and precisely what it is that they can do to halt and reverse this disease. I have no interest in counseling patients who merely want to slow the rate of disease progression.
Right.
We have to have a shared vision that the goal here is to absolutely annihilate this disease. And so in addition to the counseling effort, we give them a pretty hefty notebook that has a copy of every one of my PowerPoint slides, several of the scientific articles, a 44-page handout with many additional recipes that add to the 150 which are in our book, which we include. There's also an hour-and-a-quarter presentation by a marvelous woman who's had 28 years' experience acquiring and preparing plant-based foods, dealing with reading ingredients, dealing with restaurants, dealing with travel.
Mm-hmm.
And then we usually have a 10 or 15-minute presentation from an earlier local or regional participant who has had a successful result, so that those who are in attendance can say, listen, if he or she can do this, I can do it. And then we have this marvelous plant-based luncheon during which we answer questions and then stay in touch as necessary through either email or phone call.
Wow, that sounds great. Doctor, I'm sorry, we have to take a short break here. We're with Dr. Caldwell Esselstyn from heartattackproof.com, and check out his website, his book too, Prevent and Reverse Heart Disease. And when we come back from the break, I want to ask him about something that's in his book about moderation and people's concepts about moderation. So I think you're going to find that interesting, what he has to say about that. And we'll be back with Dr. Caldwell Esselstyn right after this break. Hey there, thanks for listening to the interview so far. I wanted to tell you quickly about a product called the Longevity Now program. It's put together by David Wolfe, who, if you haven't heard, is one of the most prolific authors out there. He's a world's leading authority on raw food nutrition and just an amazing guy. So we've been following his work for many, many years, and he's doing a lot of groundbreaking work in the area of calcium and how to dissolve these bad calcium deposits in our body. And that's what's responsible for fibrosis and calcium buildup, and essentially that's what takes down all mammals. Getting rid of this bad calcium in your body is imperative if you want to live a long, healthy, disease-free life. So the Longevity Now conference, you can either attend it or you could purchase the DVDs and the workbooks online, and I've done both, and they're extremely powerful. They're very motivating, and it helps you follow a protocol that will help you prevent and reverse diseases. It's incredible. So I would highly recommend you check it out. You can learn more at extremehealthradio.com/longevity, and please visit our sponsors, as this is the way that we're helping to maintain ourselves and to get to a level of sustainability. So thank you so much for listening, and let's get back to this interview. Okay, we're having a good time with Dr. Caldwell Esselstyn, getting a really, really great breakdown of what's causing heart attacks and what's causing heart disease and all of that stuff. And his website is heartattackproof.com, and his book is Prevent and Reverse Heart Disease. And before the break, I wanted to ask you, Doctor, you've got, I believe, a chapter in your book about moderation. And people tend to say, do all things in moderation, but you have quite a bit to say about that, don't you?
Well, it's totally an oxymoron when it comes to food. For instance, let's say that you understand what are the foods that are going to injure the endothelium. And, let me give you an example. Mm-hmm. I recently made a presentation at the State of Texas Academy of Family Practice. And after the presentation, there was a wonderful young physician who said, well, Dr. Esselstyn, that sounds a little tough. I said, well, no, wait a minute. Let's just talk about this. Here are the foods we've asked you to eat. We want you to eat all these marvelous whole grains for your cereal, bread, and pasta. 101 different types of beans, legumes, or lentils, as it were. All the wonderful red, yellow, and especially green leafy vegetables and fruit. And there are hundreds of wonderful recipes from everything from appetizers to the meals to desserts. Mm-hmm. And all we're simply asking you to do is to transition from one pile of delicious food that is absolutely killing you and destroying you to another pile of delicious food, every single item of which you have probably eaten in the past. You're not going to get any strange foods. It's just that we've asked you to think about denying yourself the foods that we know from studies are going to injure you. And he said, well, how about just occasionally? And I said, well, do you mean, say, on the weekends? He said, yeah, on the weekends. I said, oh, all right, let's look at it this way. That you're asking me if it wouldn't be okay 104 days out of 365 in the year. You're asking me if it would be okay on 104 days to continue to eat foods that are going to destroy my endothelium. I said, that's great if you want to think about having maybe just a small stroke or a small heart attack, a mild amount of dementia, maybe just a touch of erectile dysfunction.
Right. What sense does that make?
And he said, I think I get it.
Yeah, it doesn't make any sense to do that, when you think about it.
Yeah, it's like saying, how much strychnine and arsenic can I have with every meal? I really developed a taste for that. Nonsense. Why eat it?
Yeah, I hear you. I wanted to bring up a couple of things that I read a few years back from Dr. Steven Sinatra, and he mentioned a bunch of supplements, and I'm curious if you take supplements. He was talking about...
I think that's increasingly, I think maybe Steve, that was several years ago before the research has come out. See, the entire supplement industry is really so very reductionist in its thinking. I think that the supplement that we want our people to take for sure is B12. Now, that's the transition from what I had in our book, which we wrote back in 2007. We've taken away the multivitamin. You probably don't have to have certainly the calcium, because if you're eating all this green leafy vegetables, you're getting all and this range of foods that we've discussed, you're getting plenty of calcium. But I would like people to take a B12 supplement. When it comes to vitamin D, I think it's probably very practical to perhaps have your level checked. And if your vitamin D level is in the low normal range, fine. If it's below that, then I think it would be prudent to consider taking 1,000 or 2,000 international units daily until you can bump it up into that low normal range. But other than vitamin D and B12, that's it. Because increasingly, as research has been done on the other agents, we find that really they're injurious. I mean, they make a lot of money for the people who are selling the supplements,
right? But
it really does nothing to add to your health.
Do you think that a diet that needs to be supplemented, I don't know, because I don't really take that many supplements, but it seems to me that you should really be getting everything from food anyway, right?
That's exactly what I'm saying. The reason we just want to be sure we cover the B12.
I've heard that even people that eat meat are still low in B12.
Well, B12 is made by microorganisms in the soil, and sometimes there's perhaps not enough, because we're not eating soil.
Yeah.
And when you think about it, if where does the B12 that you get in meat come from? It comes from the ruminant, the animal that's grazing, getting it. And if we were grazers, we'd probably get enough. But
I see.
I just think that we have to be sure to cover B12, and that's why we suggest a supplement of maybe 500 micrograms daily.
Well, that makes sense, because if we're not getting enough B12, some people might say, oh, well, your diet's deficient. But if we're really kind of raping the soils and, not really taking care of the soils, and that's where we get it, then that would make sense, wouldn't it?
Well, actually, we do make B12 ourselves. And for instance, the Tarahumara Indians in northern Mexico, the Papua Highlanders in New Guinea, they're not deficient in B12 and not anemic. But also, the hygiene that we have here is so strict with our bathrooms and personal hygiene that we don't. How can I say this delicately? We don't transfer the B12 that we make into our food.
I see. Yeah, because I've heard that a lot of the nutrients and minerals and all of that stuff that we can really, if our bodies were operating correctly, we would all be making those in our intestinal lining and things. Well,
we certainly can absorb them. I mean, that when you think that the body has this amazing capacity to, for instance, if it starts to get low in iron, shall we say, it just opens up the door in the intestines, so we absorb more iron, and it has the ability to do this with so many nutrients in a very skillful and safe way.
Now, I was going to ask you too. You mentioned juicing a while back. I was curious, if someone were to do juicing and they did something like a really, really low sugar or maybe no sugar, but they juiced a lot of greens, do you think that would be helpful?
No. Well, then you're missing. You see that you missed the point. that I made earlier, remember how important it is to chew the greens and have them mixed with the facultative anaerobic bacteria that reside in the crypts of your tongue? If you totally bypass one of the most important parts of the gastrointestinal tract, the mouth, and dump this sugar directly into the stomach, not good. And also when you juice, you totally throw away one of the most very valuable parts of the plant, which is fiber. I mean, we didn't come down through the evolutionary pathway holding in our arms a juicer or a blender. That's why we got these wonderful teeth.
Right. That's funny. Yeah, it makes sense. But yeah, a lot of people love juicing, but I guess, No,
I know a lot of people love juicing. A lot of people love cocaine. A lot of people love cigarettes.
Right. And now, I would be remiss if I didn't ask you about statin drugs and all of those things. Can you comment a little bit about what these things are doing to artificially manipulate levels in the body and what they're doing to people?
Well, I think the bottom line is that probably in patients who have cardiovascular disease established, there's no question that the data suggests that there is going to be some benefit. When you take it just because you're going to protect yourself from getting a heart attack, it's very, very hard to see that there's any benefit. So that whole idea of putting statins in the water is absurd. It's enough now that with 20 years exposure, we know that you are at risk, a small risk, of developing diabetes if you take statin drugs. We know that there have been reported and documented instances where there have been cognitive defects, where it's problematic with the memory and so forth. And also, there is unquestionably a problem with muscles. I mean, that's when patients will take statins and they'll get so much muscle soreness that they really have to abandon taking them. Well, that doesn't mean that they can't halt this disease. Some of our most profound patients who provided evidence of disease reversal were those who absolutely could not take any statin drugs, and they just simply do this through food alone. And when you think about it, the reason that the Tarahumara Indians and the Papua Highlanders in Central Africa have absolutely no cardiovascular disease is not because they're all taking statins. They never heard of or saw a statin pill. It's simply because of the fact that they're eating a plant-based nutrition.
Yeah. People aren't naturally deficient in statin in their body, are they?
No. What a statin does, it's very interesting how the vocabulary of the pharmaceutical companies that make statin drugs, they call it an HMG-CoA reductase inhibitor. Now, HMG-CoA reductase is an essential enzyme in our ability to manufacture and make cholesterol. We have to have cholesterol. Right. Every single cell membrane in our body is made up of cholesterol. It is there. We need it. That is what the body manufactures it. But the drug companies didn't want to say that a statin is a toxin or a poison or injures the HMG-CoA reductase enzyme. They've chosen the term an inhibitor, and it just makes it sounds like it's totally benign. But anytime you take any medication or drug, it doesn't affect just a few cells in the liver. Right. Absolutely every cell in the body is going to, through circulation, is going to be exposed to this drug, and that's why anytime you turn on your television and all day long you hear the pharmaceutical companies advertising medications and drugs, they try to explain what the drug's benefits are in one sentence, and then the rest of the entire commercial is explaining away the side effects, right. not infrequently, those of which may include death. Right. So it's kind of, it's really very important, as long as possible, to get your nutrients and health benefits from the food you're eating. I use the medication, when it's appropriate for the situation that is required. Yeah,
I completely agree and hear that point. And so, what do you think are some other things that could affect the heart in a damaging way? Some people think running is really bad, marathons, or stress and anger. Outside of food, what types of things are kind of damaging to the heart?
Well, it's interesting that if we're talking about coronary artery heart disease, I'm going to just throw out an example of the Papua Highlanders for a minute. Okay. The Papua Highlanders live in New Guinea at an altitude where the air is beautiful, pristine, and clear, and yet they have a very, very high rate of morbidity from an illness from pulmonary lung diseases. Okay. And So when you study their culture carefully, they have a habit of raising a very harsh tobacco. And it's customary that when they raise this harsh tobacco and they roll it into cigarettes, they smoke these cigarettes in these large communal hutches together.
Okay.
So not only do you get the benefit of your own smoke going into your lungs, but you get all that second and third hand from your neighbors.
Right.
And so interestingly enough, when studies are done and you autopsy the Papua Highlanders who do all this smoking, which we've talked about for years as being a very important risk factor for heart disease, when you autopsy the Papua Highlanders, their blood vessels are absolutely pristine. They're clean.
Really?
And here they are dying of smoking diseases, but their arteries are fine. Why? Well, what do they eat? They eat apparently about 19 different varieties of sweet potato. And now, this is not to say for a minute that smoking isn't a risk factor for heart disease, because when you are eating the typical Western diet of oils, dairy, and meat, now you add cigarettes to that, and you, of course, markedly accelerate the disease. But it's interesting from the standpoint of epidemiology and studying the disease, how a risk factor like smoking has almost zero impact on vascular disease in the absence of the Western diet.
Wow, that's interesting. And
yeah.
Wow. So what kinds of foods do you eat? What do you normally eat on a day-to-day basis?
Exactly what I mentioned earlier. We start off with whole grains for your cereal, breads, pasta, all those 101 different types of legumes and beans.
Okay.
The full range of red, yellow, and especially the green leafy vegetables and some fruit. But Anne has been extremely clever, and she is responsible for all the 150 recipes in our book, and kind of exciting.
Wow, that's great. So you get to eat well and a lot of good recipes in that book. That's great. So what kinds of things are you, as we're closing out the show here, what kinds of things are you going to be working on, or projects you're doing and things like that?
Well, right now we're trying to publish the results of 225 patients. Our earlier study was a small study, which was just done to demonstrate proof of concept and show that we could halt this disease and reverse it. And those are patients, many of whom were followed over 20 years. And now in this more recent study, not as long, close to 4 years, but with everybody who is really severely ill with coronary disease, it's been very exciting that we found that the compliance or the adherence to our nutritional program is close to 90%, 89.3%. And what's even more exciting is the fact that in follow-up, of those patients who are adherent and follow the program, 99.4% of these seriously ill patients have avoided any further cardiac events.
Wow, 99.4. Wow, that's amazing, amazing stuff. Well,
what happened, this is what always happens when you are treating the causation of the illness, which is what we're doing differently than most of the standard cardiology programs, because, you see, I think there's been a basic covenant of trust since the days of Hippocrates, that whenever possible, the caregiver is going to share with the patient what is the causation of their illness. That's how we always do the very, very best. So far today, sadly, that's not being done in cardiovascular medicine. Patients will get their first stent, they're okay for a year or two, another stent, more stents, maybe they need to throw in a bypass, some more stents, finally they get congestive heart failure, and die. Of what? They die of a completely benign foodborne illness that never had its causation treated.
Wow. You know, I just love what you're doing. I love your work, and I love the hope that you're giving people and kind of putting the power back in people's hands by controlling their diet. It's great stuff. And I wanted to thank you for being on our show today, too.
Thank you, Justin.
Yeah, thank you so much. Would you mind holding on the line as I close out the show?
Yeah.
Awesome. All right, well, thank you again. And thank you so much, everyone, for joining us on another edition of Extreme Health Radio. It's an honor to be with you. And go ahead and visit Dr. Caldwell Esselstyn's website, heartattackproof.com, and check out his book, too, Prevent and Reverse Heart Disease. I think you're going to really, really learn a lot from it. And I wanted to thank Mike Adams of naturalnewsradio.com for having us on his network. I wanted to also let you know that we are 100% listener supported. So if any of you would like to donate even as little as $1, $2, $5, $10, anything you have to help support the growth of this network, we would be greatly, greatly appreciate that. My wife and I would be very honored that you would do that. You can do so through PayPal. It's 100% secure, and you don't even need a PayPal account and any of that stuff. So, but also we have a store on our website where we sell blenders and rebounders and dehydrators and things like that too. So we've got lots of great stuff on our store, and we'd appreciate it if you would visit our store. That would help support us as well. And we also have a great mailing list if you want to join. We send out about once a week, and you can also follow us on Facebook too. That would be lots of fun to have you part of our community. So that would be great. And thank you so much for listening. You're doing the best you can, and continue to do better this year.